Hi, and welcome to today's webinar. Before we get started, I have a couple of announcements. The Johnson Center provides this free webinar series, so this information is accessible no matter where you may live. We host several webinars per month, so visit our website to see the current schedule. Just go to www.johnson-center.org and select the webinars button on the right-hand side of the screen. New webinars and events are often added, so I encourage you to visit our website and select the Join Our Email List button that appears on the homepage. And to get up-to-date news and events from the Johnson Center, follow us on Facebook, Instagram, and Twitter, as we often announce grant and scholarships, research opportunities, and special events and presentations there. And be sure to check out our YouTube channel at youtube.com/the Johnson Center, where you will find a library of several of our past webinars covering a wide variety of topics. Be sure to follow our social media pages for information on events and announcements. Right now, our Take Action for Autism auction is open. This is an online auction with something for everyone, and all proceeds go towards summer programs for people with autism and their families. So visit www.takeactionforautism.org. And for those of you with younger kids, be sure to check out our Teddy Bear Clinic coming up on April 21st. More information can be found on our blog and social media pages. We also encourage you to follow our colleagues at the Autism Research Institute, as they host their own webinar initiative and they share some great resources on their website and social media pages. If you would like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, you may type them into your GoToWebinar control panel. If you are watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. So now let's get started. Today's webinar is presented by Jeanna Hill. Jeanna is a certified child life specialist and is the family care coordinator here at the Johnson Center, where she has coordinated comprehensive care programs for families for almost 7 years. Jeanna's commitment to helping families find the resources and support they need is second to none, and her focus in developing sibling support programs, medical play programs to help children deal with anxiety and fears related to medical care, and inclusive social skills opportunities for children with developmental disorders or chronic health issues has hundreds of children and families. Please welcome your presenter, Jeanna Hill.
Thank you for attending today's webinar. Today we will be discussing the impact of hospitalizations or other medical experiences on school-age and adolescent children. Research has found that long-term illnesses and stressful medical experiences can lead to trauma and anxiety for children. The stress of these experiences can result in negatively impacting a child's cognitive, emotional, and social development. For many children, there are helpful strategies that we will discuss today that can reduce the stress and anxiety these children may face during a medical encounter. We will also be discussing how to identify and address those children that are potentially at risk for traumatic experiences. For those tuning in, you may be parents or professionals that have or work with children with autism or other developmental delays. We will also be discussing how this specific population can be affected and ways that we can modify or adapt our intervention strategies to meet the needs of this population. My hope is that healthcare professionals and parents listening today will be provided with some helpful information on how to recognize characteristics of stress and anxiety in children and identify ways to help prepare children for any medical experience that they may encounter. So before we start, I'd like us to get a better understanding of child development. We will briefly review child development theories, including Erikson's developmental stages and Piaget's cognitive developmental theory. Though both theorists review developmental theories from children birth to adulthood, today we will be focusing on the school age and adolescent age range. If you're interested in the impact of medical experiences on early childhood development, I would encourage our viewers to check back on our part 1 of this webinar series on our YouTube page. As many professionals that work with children know, there are several developmental theories that help us to identify areas of growth and development. Erickson's developmental stages help us to identify crises within each stage. Piaget's cognitive developmental theory focuses on the structure of the stages and less on the problems of the movements within them. He believed that learning should be a process of active discovery and should be geared to the child's stage. To recap early developmental stages of Erickson's developmental theory, the first is trust versus mistrust. In this stage of life, infants learn if their caregivers are predictable, they develop a sense of assurance. If trust is achieved over mistrust, infants are more likely to have a sense of hope. The next stage is autonomy versus shame. In this stage of crisis, children learn how to adjust to social regulations without losing their sense of autonomy. If they resolve this issue, they develop a sense of will, or the ability to control their impulses. Initiative versus guilt is the third stage, and parents can help children through this stage of crisis by providing a strong sense of purpose. And industry versus inferiority. This is the most decisive stage of growth and the focus of today's webinar. I also want to quickly review Piaget's cognitive developmental theory. The first is sensory motor. This phase targets birth to 2 years and infers that babies organize their physical actions such as sucking, grasping, and hitting in dealing with the immediate world. They then enter the pre-operational stage. This phase targets children 2 to 7 and theorizes that children learn to think and use symbols and internal images, but their thinking is unsystematic and illogical. So it's very different from adult thinking. The next phase is concrete operations, and this is one of the phases that we'll be discussing today. Children in this stage develop the capacity to think systematically, but only when they can refer to concrete objects and activities. This phase targets school-age children, ages 7 to 11, and we'll go into more detail about how this phase can be impacted by stress or anxiety related to medical experiences. The last phase is formal operations. This is the final phase according to Piaget, who believed that young people in the age range of 11 through adulthood have now developed the capacity to think systematically on a purely abstract and hypothetical plane. This directly impacts an adolescent's social thinking and moral judgment. So according to Erik Erikson's theory, we all encounter a certain crisis that contributes to our psychosocial growth at each stage of the psychosocial development. Whenever we experience such crisis, we are left with no choice but to either face it or think of ways to resolve it. Failure to overcome such crisis may lead to a significant impact on our psychosocial development. Today, we will be reviewing Erikson's theory on school age and adolescent ages, specifically those in the 4th and 5th stages of development. As you can see, I've highlighted those sections to focus on the characteristics within these stages. For those that are interested in infant and preschool stages, again, I would refer back to our previous webinar for more information. So a crisis that begins during this stage of development is that school begins. Children are evaluated for the first time with a formal system and they're compared to their peers. Children often begin to wonder if they feel good or bad about their accomplishments. At earlier stages of development, children were largely able to engage in activities for fun and to receive praise and attention. Once school begins, actual performance and skills are evaluated. Grades and feedback from educators encourage kids to pay more attention to the actual quality of their work. During school and other social activities, children receive praise and attention for performing various tasks such as reading, writing, drawing, and solving problems. Children who do well in school are more likely to develop a sense of competence and confidence. They feel good about themselves and their ability to succeed. Children who struggle with schoolwork may have a harder time developing these feelings of sureness. Instead, they may be left with feelings of inadequacy and inferiority. So it is at this stage that the child's peer group will gain greater significance and will become a major source for a child's self-esteem. The child now feels the need to win approval by demonstrating specific skills that are valued by society, and they begin to develop a sense of pride in their accomplishments. If children are encouraged and reinforced for their initiative, they begin to feel industrious and feel confident in their ability to achieve goals. If this initiative is not encouraged, if it is restricted by parents and teachers, then the child begins to feel inferior, doubting their ability, and therefore they may not reach their full potential. If the child cannot develop the specific skills they feel society is demanding, then they may develop a sense of inferiority. Some failure may be necessary so that children can learn to develop modesty, so there's a balance between competence and modesty. Success in this stage will lead to the virtue of competence. During the industry versus inferiority stage, children become capable of performing increasingly complex tasks. As a result, they strive to master new skills. Children who are encouraged and commended by parents and teachers now develop a feeling of competence and belief in their abilities. Those that receive little or no encouragement from parents, teachers, or peers will doubt their ability to be successful. Children who struggle to develop this sense of competence may emerge from this stage with feelings of failure. This can set the stage for later problems in development. People who don't feel competent in their ability to succeed may be less likely to try new things and more likely to assume that their efforts will not measure up under scrutiny. Moving on to Piaget's developmental theory, children in this stage are in the concrete operational stage, and it's the third in Piaget's theory of cognitive development. This stage lasts around 7 to 11 years of age and is characterized by the development of organized and rational thinking. He considered the concrete stage a major turning point in the child's cognitive development because it marks the beginning of logical or operational thought. The child is now mature enough to use logical thought or operations, such as rules, but can only apply logic to physical objects, hence concrete operational. The concrete operational stage of development marks a critical shift and advancements in how children think. While their thinking tends to be more concrete, children become much more logical and sophisticated in their thinking. While this is an important stage in and of itself, it also serves as an important transition between the earlier stages of development and the coming stage where kids learn how to think more abstractly and hypothetically. So now that we have reviewed theories of child development, let's focus on how development can be impacted by the medical encounter. What are some primary concerns within this stage of development? One of the most common concerns in this stage of development is the risk of misconceptions. According to Piaget, children have now developed concrete thoughts. Some of the most common misconceptions include standard procedures such as completing blood work or non-invasive tests such as getting an X-ray or a CT, also known as a CAT scan. For our young magical thinkers in this stage of development, hearing that they have to get an X-ray can be scary. For example, take into account how similar images of X-rays are to pictures of Halloween skeletons. For young children, a skeleton is most often used during Halloween, representing a character that is spooky or scary. And while we know X-rays are not painful and do not include jumping skeletons, we may want to clarify that to our kids. Instead, help them to understand that an X-ray is only a picture, and talk about a time when they had to recently take a picture. What did they have to do? They had to hold really still. The picture did not hurt, and it was pretty fast. This is what they can expect from an X-ray. An X-ray helps the doctor take a really cool picture. You also want to be sure that when you're explaining a procedure to a child, you are taking into consideration their developmental level of understanding. Younger school-age children may benefit from explanations right before the procedure, so they don't have too much time to worry or to forget. Older children may want more information. For example, how does an X-ray work? How long does it take? And what happens if they move? For children within this stage of development, they are at risk of limited opportunities to achieve and compete due to multiple school absences or inability to join activities. So this impacts their social development as it limits opportunities for socialization. This age group is also affected cognitively as they are at risk of limited comprehension or understanding of their diagnosis or treatment. So what can we do to support children in this stage of development? We can encourage creative activities, and one way is through medical play. Medical play allows a child to freely explore materials that they are likely to encounter during their medical visit. Parents can provide this opportunity prior to their appointment or after, depending on the level of anxiety that the child has. For example, in this picture, it looks like the child is pretending that the doll is completing the same test, and the therapist is able to observe how the child goes through the process. For example, if a child's going to an eye doctor, will they pretend that the child's having a shot in the eye? This gives parents or providers a chance to clarify those steps while being able to observe those underlying fears. Therapeutic games and activities can help children become more familiar with medical supplies in a non-threatening way and can help patients become desensitized to particular items that they may be fearful of. Needles, syringes can all be really threatening for some children, but when you fill a syringe with water or paint, all of a sudden it becomes a fun item. Syringe painting is a great activity for providers to help children become familiar with the item and less fearful of taking medication. For those patients that are fearful of needles, it may be helpful to describe what the needle is. You can describe the needle as a helper and use a pillowcase to help a child understand. If you are going to sew through a pillowcase, would you use something like a straw? Most likely the straw would bend. You need a helper instead. So the needle goes into the catheter, or the straw, which is a way that the doctors or nurses can find the best spot. Once they've found the best spot, the helper comes out and the straw stays in. This is how we get medicine into our bodies and makes us feel better. The straw is something that children are more familiar with versus saying the catheter. You can talk about how it bends and how small it is. You can also allow the child to touch the straw. You may also want to have a few medical play sessions after a child has a procedure so that you can help them cope with the experience. Again, providing a safe and non-threatening way of exploring the items can help them to process their emotions. Think about creative ways that you can include medical supplies in familiar games, such as hospital bingo. Hospital bingo allows patients to become familiar with items such as needles and band-aids and a thermometer in a way that's fun. They are actively seeking these items in hopes of winning. Other simple ways that children can become familiar with items include creating coloring books. Find non-threatening images and include them in coloring pages that children can play with while they wait. This helps them to identify those items later on. You can also provide children with knowledge about their condition or the procedure. And remember, it's what you say and how you say it. Language can be harsh or scary depending on the words that you choose. So think of ways to communicate using non-threatening words. For example, instead of saying, "You're going to the hospital" or the doctor's office, you can make it personal and say, "Tomorrow we are going to see your friend Anna," who may be a nurse there. It's never productive to lie to a child or to give them a sense of falsehood. This typically increases a child's fear once they realize they've been lied to. In some cases, parents or clinicians may feel like the less the child knows, the better, which may be true depending on the patient. Explaining the event or talking about the experience may be less productive to a child that's already overly anxious or fearful. So caregivers and clinicians, make sure that you're accurately assessing a child's level of anxiety to determine the most appropriate method of preparation. You should also use honest and developmentally appropriate explanations to help a child understand the experience. Parents, it might be helpful to use words that your child knows to describe the experience in relation to how it will directly affect them. So you could say things like, "The room is going to be cold, the lights will be bright, you can have your iPad so you can watch a video." Professionals think about ways that you can allow a sense of control or provide choices during the procedure. This is especially important for our school-age kiddos. You can say things like, "You can choose to sit by yourself," or "You can sit on a parent's lap," or even offer a color Band-Aid to choose from. Healthcare professionals explain the procedure in a calm voice and talk both to the patient and parents. If a parent is stressed, the child will likely be stressed. Some parents choose not to allow their child to observe the procedure, such as a blood draw, for fear that it might scare the child. While this may be true for some, for others this may actually increase their fear or anxiety. If mom or dad doesn't want me to see this, it must be really scary. So instead, offer the choice to look or to look away. And if they choose to look away, be prepared to bring an item to distract, such as a video or a book or even something on your phone. You also want to make sure that you provide opportunities for mastery and competence. And again, this goes back to our theory of child development. This could be encouraging participation in social activities or providing bedside games. School-age children should be encouraged to keep up with missed schoolwork and to provide opportunities for academic achievement. You can also encourage participation in sports activities, including the Special Olympics. This would help provide experiences to practice competitiveness and achievement. Verbal praise can also be really reinforcing. You can have something like a certificate or a gold star ready to give the patient after they are done with their procedure. A great idea would be to have the nurse or maybe a child life specialist sign a certificate beforehand and present it to the patient when they're done. Depending on the child's developmental age, providing choices can make a significant impact in their ability to cope with the experience. From a developmental standpoint, we know that by providing choices, we are creating opportunities for children to gain control over the experience and their body. You also want to make sure that you maintain normal routines and you promote social experiences within the medical setting, including taking trips to the playroom. Maintaining normal routines could be keeping up with schoolwork and creating opportunities for socialization, as well as being active and participating in holiday and event activities within the medical environment. So this includes hospital birthday parties, trick-or-treating in the hospital, Christmas parties, and more. It's important to maintain a normal routine and provide consistency for children in this age group. This will help them build confidence and become more adjusted to their surroundings. It's also healthy for their overall growth and development. Moving on to the adolescent age range, according to Erickson, as they transition from childhood to adulthood, teens may begin to feel confused or insecure about themselves and how they fit into society. As they seek to establish a sense of self, teens may experiment with different roles, activities, or behaviors. According to Erickson, this is important to the process of forming a strong identity and developing a sense of direction in life. Identity versus confusion is the fifth stage of Erickson's theory of psychosocial development. This stage occurs during the adolescent ages of 12 to 18. During this stage, adolescents explore their independence and develop a sense of self. During adolescence, the transition from childhood to adulthood is most important. Children are becoming more independent and begin to think in terms of their career and future relationships, families, housing. The individual wants to belong to a society and to fit in. This is a major stage of development where a child has to learn the roles that they will occupy as an adult. It is during this stage that an adolescent will re-examine their identity and try to figure out exactly who he or she is. During this stage, the body image of an adolescent changes. Erickson claimed that the adolescent may feel uncomfortable about their body for a while until they can adapt and grow into the changes. During this period, adolescents explore possibilities and begin to form their own identity based upon the outcomes of their explorations. Failure to establish a sense of identity within a society, for example, not knowing what they want to be when they grow up, can lead to role confusion. Role confusion involves the individual not being sure about themselves or their place in society. In response to role confusion or identity crisis, an adolescent may begin to experiment with different lifestyles in their work, education, or political activities. Resolving the crisis at this stage of development involves committing to a particular identity. This might involve committing to a career path, deciding what social groups to associate with, and even developing a sense of personal style. Those who are successful develop fidelity, a psychological virtue characterized by the ability to relate to others and form genuine relationships. Fidelity involves being able to commit oneself to others on the basis of accepting others, even when there may be ideological differences. To review Piaget's cognitive developmental theory, adolescents in this phase of development are in the formal operational stage. At this point in development, thinking becomes much more sophisticated and advanced. Kids can think about abstract and theoretical concepts and use logic to come up with creative solutions to problems. Skills such as logical thought, deductive reasoning, and systematic planning also emerge within this stage. So what happens to those who do not end up successfully forming an identity at this point in development? Kids who are not allowed to explore and test out different identities might be left with what Erickson referred to as role confusion. These individuals are not sure about who they are or what they like, and this makes adolescents vulnerable in the medical setting. In addition, adolescents are often a neglected group in a medical or hospital setting, sometimes placed in adult units or overlooked compared to their younger peers. Adolescents may be struggling with their identity and considering plans for the future. Concerns and insecurities about physical development are key. In the event of a hospitalization or a long-term experience, adolescents may find it difficult to achieve personal or developmental goals. In a period of seeking independence from adults, teens are subject to be completely dependent on others in the event of a medical encounter. Future plans must be put aside, relationships put on hold, and in addition, at a critical time when socialization is so important, teens are forced into experiences that might label them as different or delay them from experiencing social events such as parties or school dances. Adolescents are more likely to be at risk of experiencing feeling different from peers and less able to compete in appearance, ability, and special skills. They are also at a disadvantage, being dependent on family members, which limits their ability to build confidence and have a sense of control. They also have decreased opportunities for abstract thinking, which may affect their cognition. So how do we provide intervention for an adolescent? Well, the first step would be to create a safe space for them. And this could be through creating teen rooms. This is a place where teens gather to talk, to read, to play music. They can play pool, prepare snacks, work on crafts. Parents and staff should encourage participation and gathering in these common areas. You could also use recreational therapy. You can incorporate games and events throughout the hospital or medical environment to create opportunities for socialization. Going back to our hospital bingo activity from earlier, this could be a great way to provide a social experience. Or you can provide an outdoor activity to help them move around and be mobile outside. For those patients that are immobile, create opportunities for fun by offering video games or bedside activities. To maintain ties with their peers outside the hospital, teens should also be awarded visitation privileges and access to phones. The concern over their rapidly changing bodies should also be addressed and privacy reinforced. You could also incorporate the use of therapy and intervention, including music therapy. Music therapy is an established health profession in which music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals. Through musical involvement in a therapeutic context, clients' abilities are strengthened and transferred to other areas of their lives. Music therapy also provides avenues for communication that can be helpful to those who find it difficult to express themselves in words. Research in music therapy supports its effectiveness in areas such as overall physical rehabilitation and facilitating movement, increasing people's motivation to become engaged in their treatment, providing emotional support for patients and families, and providing an outlet of expression for feeling. You should also find ways to make therapy and intervention fun. Animal-assisted therapy is a therapeutic intervention that incorporates animals, such as horses, dogs, cats, pigs, birds, into the treatment plan. It's used to enhance and complement the benefits of traditional therapy. Animals can provide a sense of calm, comfort, or safety and divert attention away from a stressful situation and toward one that is more pleasurable. Advocates of animal-assisted therapy say that developing a bond with an animal can help people develop a better sense of self-worth, of trust, help to stabilize their emotions and improve their communication, help with self-regulation, and with socialization skills. Some of the benefits of animal-assisted therapy include increased self-esteem and ability to care for oneself, reduced anxiety, grief, or isolation, improved willingness to be involved in a therapeutic program or group activity, increased trust, empathy, and teamwork, greater self-control, enhanced problem-solving skills, reduced need for medication, and improved social skills. Because many teens enjoy working with animals, animal-assisted therapy can be particularly beneficial for individuals who are resistant to treatment or have difficulty expressing their emotions. Now that we have reviewed intervention strategies for school-age and adolescent children, let's think about ways that we can address the needs of children with autism. When working with children with autism, it's important to recognize the different developmental needs as opposed to age expectations. This allows a child to be assessed according to their ability and strength and not held accountable for skills they have not yet learned or achieved. It's important to be aware of a child's developmental level, as this will affect how a child interprets, comprehends, and reacts to the overall medical environment and information that is given. In the following slides, we will discuss children who fall into different developmental levels versus different age stages. Level 1. At this stage of development, children need to know that they are safe. This is true for all children regardless of diagnosis. Children with autism in this level enjoy being touched in a soothing manner and find security in being held. They may communicate without words, conveying their message through looks, gestures, and facial expressions. Children in this level also respond well to routine, repetition, and rhythm. In this second developmental level, children are curious and seek more independence. They may begin to explore the world around them. They may also experience feelings of inadequacy or failure when they are not pleasing caregivers or successful in their work. Children in this level struggle between seeking independence while also monitoring if caregivers are present and watching. Children in this level also begin to learn about object permanence. That is, realizing that objects continue to exist even when they cannot be perceived, seen, heard, touched, smelled, or sensed in any way. They enjoy games like peekaboo and blowing bubbles, which acquires joint attention. Children are likely to have developed more language in this level and enjoy opportunities for learning. In level 3, children begin to take more initiative, participating in household tasks, mimicking adults, and intensifying their independence for play skills. Children in this stage also develop a sense of guilt if they do not live up to expectations or fall below standards. Children in this level also tend to feel responsible for the outcome of the situation, seeing the world from their personal perspective. At this level, children are able to take turns and play games while following the rules. They have growing imaginations and are more likely to tell stories or play with inanimate objects such as dolls to depict feelings or emotions. In this level, children are seeking confidence and feel the need to accomplish something in order to feel important. Children in this level often feel the need to demonstrate success by performing a task that caregivers can watch. Rules become very important at this stage. Children in this level also have skills needed to relate to peers and to participate in a social group. By level 5, children have acquired the skills necessary to start and complete a task. Children in this level are also able to make personal choices as well as establish long and short term goals for themselves. Children are able to describe ideas and values, they understand order, regulation, and they have developed problem solving skills. They seek out others to gain information. The influence, attention, and reaction of peers also greatly increases and motivates their choices. By shifting from thinking of age-based developmental stages and understanding skills within each developmental level, caregivers and healthcare providers can better assist a child through their medical experience. Once the developmental level has been assessed and established, accommodations can be made based on the child's level of understanding. So here are some assessment types that you can go through when trying to assess a child's developmental level. You can go through an initial assessment, which we'll be discussing here in a bit, an individual developmental assessment, an environmental assessment. You can go through participation and information planning, which outlines what information needs to be conveyed and the best modality for communicating it, and then assess what intervention strategies to put in place. These assessments can be performed by parents or non-medical team members or by the medical team, and we'll review how to go through these assessments shortly. So the initial assessment consists of obtaining basic information about the child and reviewing pertinent information such as stress triggers and motivators that can help parents and staff apply successful intervention supports. Additional information that you can gather during the initial assessment could be activities that the child enjoys participating in, activities that a child typically avoids, and communication systems that are in place for the child. When completing an individual developmental assessment, we'll go through each of the levels and characteristics or questions to ask within each level. For example, if you're trying to assess if a child falls into a developmental level 1, you want to be able to see if they respond to their name, a soothing touch, attends to the speaker, responds to imitation play. There are many different assessments that you can make, but these are just some that will help guide you through trying to assess if a child falls into a level 1 or a level 2 up until level 4 or 5. Here are some examples of questions to ask if you're trying to identify if a child falls into a developmental level 2. Have they developed language? Are they requesting help? What are their communication needs? Are they curious about their environment? Are they able to describe themselves to others? Are they able to sit and attend and to wait? Are they able to identify colors and shapes and complete a task? There are other characteristics that you can look for, such as if they are able to respond to affirmation from others, if they demonstrate gross or fine motor skills, if they demonstrate repetition in play and task, if they understand the concept of one, if they enjoy playing games such as peekaboo or blowing bubbles, as we mentioned earlier in the webinar, and if they have the ability to understand object permanence, or the awareness to be able to understand when people and objects leave but also return. Here are some questions to consider when identifying if a child falls into level 3. Do they demonstrate imaginative play? Do they interact with others? Are they able to follow the rules when playing a game? Do they recognize order and sequence, cause and effect? Do they use increasing description details? Are they able to understand a series of photos or convey simple stories? And do they interact with others? Additional characteristics to assess children in this level are their ability to share materials, participate in social groups, ability to express reason for expectations of self, and taking initiative to try new tasks. Here are some questions to consider when identifying if a child falls into level 4. Do they desire step-by-step information? Do they understand order, sequencing, cause, and effect? Are they competitive with peers and complete tasks for praise? Do they verbalize their feelings? And do they enforce rules and regulations? You may also notice and assess children in this level are also able to discriminate values to assist in choice making. Their ability to listen to others' thoughts and opinions is higher, and they have the ability to maintain control when provoked. And last, here are some questions to consider when identifying if a child falls into level 5. Are they an abstract thinker? Do they have plans for the future? Are they able to determine long and short-term goals? Do they convey logical sequence of events and understand hypothetical situations? Do they seek the opinion of their peer group? Can they discriminate between fact and opinion? And do they demonstrate work skills or make personal choices? So now that we have reviewed the initial assessment and the individual developmental assessment, and you have an idea of what level they lie on, it's important to also think through environmental assessments. Think about the noise level. Are noises in the medical environment high, low? Is the child distracted by the noise in the room? What sounds does the child prefer? Which sounds does the child have an adverse reaction to? And is the child able to hear the information being given? All of these questions can help with their ability to process information. You should also include and consider the visual stimuli when you're doing an environmental assessment. For example, think about how many people are present in the room. Are there more adults or children present? What items will the child most likely see from his or her height? Which items in the room are familiar to the child and which are unfamiliar to the child? You should also be mindful of odors, especially in a hospital environment, and think about what smells are unfamiliar that the child may encounter for the first time, and what smells will the child encounter suddenly. It's also important to consider movement and how that will affect a child. For example, will the child need to demonstrate movement of a particular body? Will they be asked to place their hands up, down, their arms still? And will they be able to follow that sequence? Will the child follow simple imitation games needed to move a body part? And how many changes in the environment will the child encounter throughout the procedure? This will help to identify if transitions are an issue. And then think about the taste. What will the child be asked to put in their mouth? Is the taste familiar to the child? And be very considerate if the child is on a specific diet. Once the environment and other factors are assessed and the child is ready, the next step is to present information and materials in a way that is clear, concise, and informative. This includes asking questions to help prepare for the appointment. For example, what are we preparing the child for? How many steps are involved? What is a child's motivating interest, and who will be present during the procedure? In addition to the questions listed, you may also want to consider a child's developmental level and how that will affect how the information is processed and received. You should also consider what difficulties could arise for the child. They can be discussed prior to the interaction and think about adjustments that need to be made prior to the procedure based on the child's fears or needs. Determining what intervention to use is an important step to support a child. After you've gone through all of your assessments, you will most likely be able to have a better idea of how to assist the child. Think about if a child has a special interest and how you can use that as a motivator. For example, if you know that a patient has an interest in Thomas the Train, you can have videos prepared for the child to watch during the procedure if able to. You can also talk to the family to see if a child has a behavior plan, such as a token system or reward book that works for the family. If the child appears stressed, you can provide step-by-step instruction or take a break from the situation. If the child has the ability to practice the procedure, it's also a great idea to incorporate opportunities for medical play. As mentioned earlier, this is a helpful technique that allows children to run through their medical experience in a safe and therapeutic way. Not all interventions work for every child, so it's important to first assess a child's needs and become familiar with different interventions and strategies that can help. Because time may not permit a full assessment of environment and developmental needs, it's important to obtain this information in advance. The more accurate information the family provides, the better the healthcare team can be prepared in providing successful support. Many people use social stories to help explain situations that may be confusing, scary, or new. The social story can help your child understand the experience, which may decrease their stress and anxiety regarding the medical encounter. These are short narratives that assist children in predicting what experiences might occur. Social stories should be concise and informative, giving the child information about the support that they need. These are especially useful to help a child navigate through a new situation and can be used to describe a specific event or procedure. The use of a visual schedule can also help support patients with autism. Establishing a routine and preparing these patients for changes in their schedule can help children with autism succeed in a new environment. By providing them with tools to understand their experience in small steps, we are allowing them to anticipate transitions and feel secure with the schedule. You can review the schedule at home before the procedure and again while waiting for your appointment. You can also create your own visual schedule by using a photograph or picture or creating a first then board to illustrate the procedure. Other support strategies that can be used for children with autism include the use of a power card. A power card is a simple story using a child's preferred interest, summarizing the simple steps a child needs to complete. You can create an easy template, and once you know what the child's preferred interest is, add it to your story. For example, in this scenario, we have Curious George. However, if our family expressed the patient was really into Thomas the Train, we would find an image of Thomas and change the scenario to include the preferred interest. These power cards are particularly helpful with 3 and 4-step commands, such as taking blood pressure or having a blood draw. You can easily use index cards and create individual power cards to take with you to each appointment. You can use these power cards when going to the dentist or the eye doctor as well. These templates are pretty easy to create and allow you to modify your appointments while still being able to use the same character. Essentially, you can use a child's fixed interest as a way to motivate their behavior. If you are specifically working with a behavioral therapist or a provider, talk to your team on how they can use power cards to help. So it's important to consider the mountain of emotion and how stressed or anxious a child is during a medical experience. For example, at the start, you can sense if a child is becoming overwhelmed or if their environment is overstimulating. If they reach a point where they're so overwhelmed and overstimulated, a child may experience a meltdown or exhibit extreme behaviors and emotions. It's at this stage where it's really hard to provide direct intervention and support. so it's best to wait until a child calms back down and begins to relax. So here are some stages that providers, caregivers, parents can go through when a child experiences these mountain of emotions during their medical experience. So first, as you notice a child is becoming overwhelmed, parents or caregivers remind child of coping techniques that they have chosen and talk through cues. You can encourage the child through every single part of the experience. So even if they are just holding still, you want to praise them for that. If you get to a level where a child is experiencing a meltdown during a procedure, try giving the child space and maintaining a quiet and calm demeanor. You should not intervene at this point or expect the child to respond directly to intervention. As the child calms back down, adults can review the episode and develop strategies for future similar situations. So time to recap. For school age and adolescent children, medical experiences can be challenging, frightening, and potentially traumatic. For children in this age range with autism, these experiences are even more challenging as these patients might not have the verbal ability to communicate and express their needs. I hope that parents and professionals listening today have found some helpful strategies on how to address the specific needs of school-age children and adolescents in the medical setting. For those that are interested in more information, I would encourage you to check out some of our references listed here. There are some great and helpful tips within these references on how to address the needs of school age and adolescent children, as well as how to address the needs of children with autism in the medical setting. I also want to just quickly mention again for those in the Austin area to please join us for our upcoming Teddy Bear Clinic. This is an opportunity to practice going through common medical experiences such as completing a physical, getting an IV, or taking an x-ray. This is a fun, free event that I encourage all families to come to. So we'll now take some time to answer any questions that you may have. So I do have a question. How can I help my teen through a procedure he does not want to go to? So I'm sure that this happens with a lot of teens. What you can do is to provide opportunity for control. You also want to make sure that you're validating your teen's concerns. Most older children will want more explanation and seek out more explanation about the procedure or the medical encounter. So try to learn as much as possible about the procedure ahead of time so that you can better prepare your teen to understand and help them to really come to terms with what to expect. If choices are possible, you can offer those. For example, if they have a choice, even in the time of the procedure or the location, allow them to make that choice. This is especially important if a procedure is outpatient. Ideally, you don't want to schedule that during a time that will conflict with school or social events. So allow them to have the opportunity to make a choice of when they would want to schedule that visit. I have another question. My child is 12 with autism. He doesn't do well during blood draws and has limited verbal ability. How can I help prepare him for the procedure? So with our kiddos that have limited verbal ability, I would encourage you to use a communication device. If you're currently using one, then you would want to bring that in. So a communication device such as a visual schedule that would be helpful to incorporate during that time so that they know exactly what steps to expect. I think going back to one of the slides, we talked about if you have a therapist that you're working with, you can ask them for support during this time in creating a visual schedule so that it can be really specific to the procedure. Okay, one more question. If my teen doesn't want to go to the doctor, how can I make her? That's also a great question. I feel like it's very similar to the first. Choosing to be healthy is an important decision for anyone, and I'm not sure what level of understanding your teen has, but if they do have the ability to understand long-term consequences and they have logical thought, I would encourage you to talk to your child about the effects of not going to the doctor and what that would mean for her body. So just again, to reiterate from earlier in the webinar, body image is so important in this age group, and many times this could be the contributing fear. She may be fearful of how this procedure is going to change her body. So identifying all of those underlying fears or characteristics and having a conversation beforehand would be a helpful start. I'm just going to take a few more questions. Where can I find social stories about going to the doctor? You can actually find those online, or you can create your own using a template. We actually have several social stories on our website that you can use as a reference. And then I see someone else has just mentioned the teddy bear clinic. The question is, you mentioned a teddy bear clinic where kids come to practice. My child is older, can they attend? Absolutely. If you feel like your child's developmental level would be appropriate, I would definitely encourage that. So I just want to thank everyone for attending today's webinar. I hope you found it useful. And if you have a chance, you can always look on our YouTube page to check out part 1 of the series for how medical encounters affect early childhood development. Again, thank you for attending.